Today we will discuss bilateral lysis of aortic saddle thrombus with early tissue plasminogen activator, a prospective randomized placebo-controlled study in feline acute aortic thromboembolism. This is a paper out of the Journal of Feline Medicine and Surgery from 2023. It is not open access, so I will just go through the abstract and then hit on some of the highlights and give you my thoughts. So starting with the objectives, the aim of this study was to investigate the impact of tissue plasminogen activator, or TPA, on the treatment of feline aortic thromboembolism. Looking at the methods, cats diagnosed with FATE involving two limbs were enrolled in a prospective, multi-center, double-blinded, randomized, placebo-controlled study within 6 hours of an event. Diagnosis was made by clinical findings and one confirmatory criteria. Cats received placebo or TPA, and the placebo was saline. All cats received pain control and thromboprophylaxis. The primary outcome was a change from baseline in a published limb score at 48 hours. Secondary outcomes included 48-hour survival, survival to discharge, and complication proportions. Statistical analysis included pattern mixture models, logistic regression, and Fisher's exact, Student's T, and Whitney-Wilcoxon test. Looking at the results, based on a power analysis, 40 cats were enrolled. However, only 20 survived to 48 hours, 12 in the TPA group, and then 8 in the placebo group. There was a statistically significant improvement in limb scores with baseline for both groups. Limb score at 48 hours was 1 point better in the TPA group, but there was no significant difference with a p-value of 0.19. Thrombolysis had no statistically significant effect on 48-hour survival with a p of 0.22. Lower affected limb lactate was associated with a better 48-hour survival, with the odds ratio being 1.5. The survival to discharge rates were 45% in the TPA group and 30% in the saline group, and there was no statistically significant difference with a p-value of 0.51. Complications in the TPA and placebo group included acute kidney injury and or reperfusion injury. So looking at the conclusions and relevance, survival and complication rates of acute aortic thromboembolism were not different with or without thrombolysis. High in-hospital mortality decreased the statistical power to detect a statistically significant difference between treatment groups with regard to the overall primary outcome. Just to go over some of the background information, recall that feline aortic thromboembolism is initiated most commonly by a sudden migration of a left atrial thrombus into the distal aorta or the bifurcation. This leads to an acute onset of signs such as severe pain, paralysis, and eventual rhabdomyolysis in pelvic limbs. The prognosis of thromboembolism is considered poor, with the rate of euthanasia being as high as 90% in some reports, often without an attempt towards treatment. With treatment, survival to discharge, at least from retrospective studies, ranges from 27% to 45%. With thrombolysis using tissue plasminogen activator, or TPA, the most commonly used form of treatment. Reperfusion injury and acute kidney injury are common in patients without treatment. Therefore, this study investigated the use of thrombolysis with tissue plasminogen activator in cats with thromboembolism. They hypothesized that early thrombolysis would be associated with a short-term improvement in motor function. A secondary outcome was to prospectively describe the natural progression of thromboembolism in cats hospitalized for treatment of their disease, including 48-hour survival and survival to discharge, as well as the identification of prognostic factors for survival. The methods are well described and seem adequate to test the hypothesis and evaluate the outcomes. Cats had to present within 6 hours of onset of clinical signs, so this is a limitation of the study, as owners could have missed earlier signs, and potentially the cat could have had clinical signs for longer than 6 hours. Diagnosis of arterial thromboembolism was based on pale, cold, pulseless, painful, and or paraparetic or paraplegic pelvic limbs. Additionally, there was confirmation of the embolism with either Doppler flow, glucose, or lactate. So these criteria are great for inclusion and exclusion in creating a good standard inclusion for this study. Cats randomly received either saline or TPA. Additionally, all cats received an opioid, low molecular weight heparin, and clopidogrel, in addition to heart medications if needed. There is the 4-point limb score that was used, and just to go through it real quickly, 1 is normal, 2 are patients that have pulses in the pelvic limbs but are paretic, 3 are patients that have pulses in the pelvic limbs but are plegic, and then 4 patients that have no pulses and are plegic. They do, in the discussion, state that they don't recommend using this scoring system as some of the patients had no pulses but were still ambulatory. Outcome was only investigated for 48 hours due to the short-term effects of thrombolytics, and based on a power analysis, 20 cats in each group were included. And I do applaud them for including a power analysis, as this seems to occur less and less with some of the newer studies. Getting into the results, looking at Table 2, there was no difference in general characteristics of the two groups, such as age, body weight, limb scores, number with heart disease, blood work changes, and so on. Median glucose in affected limb was 100 milligrams per deciliter and 280 in the normal limb. Mean lactate was 11.3 in the affected limb versus 3.4 in the normal limb. Echo revealed heart disease in over 90% of cases, and then neoplasia was thought to be the cause in some of the other cases. Echo also revealed echogenic contrast in 25% of the TPA group versus 55% in the saline group, and intracardiac thrombus in none of the TPA group versus 22% in the saline group, but I'm not sure if this was before or after treatment. In regards to treatment, both groups had improved limb scores, and although the TPA seemed to have the slight edge in the score, again, like what was mentioned in the abstract, there was no statistical difference with a p-value of 0.19. Only 20 cats made it to the 48-hour point of the study, 11 in the TPA group and 9 in the saline group. 13 of the cats were euthanized due to client and clinician decisions, so this could absolutely skew the results. Rectal temperature was associated with outcome, with 96.2 degrees Fahrenheit being the optimal cutoff, though the sensitivity and specificity was only fair. Similarly, a lactate higher than 11.5 millimoles per liter was associated with a worse outcome, with, again, a fair sensitivity and specificity. About 20% of cats in both groups were diagnosed with acute kidney injury, then 1/3 in the TPA group, and then 19% in the saline group were diagnosed with reperfusion injury. Survival to discharge was 46% in the TPA group and 33% in the saline group, with a p-value of 0.674. So although it's better in the TPA group, again, not significant, and the 1-year survival for the TPA group was 33% versus 0% in the saline group. Looking through the discussion, although TPA had an edge on limb score and outcome, it was not statistically significant, and though this could be related to the number of cats euthanized in the study, it's hard to say at the moment. Additionally, male cats were overrepresented in the study. They also state that lactate might be better than using glucose for evaluation of thromboembolism. The paper goes into a lot of detail of treatment in people, and that perhaps treating these patients sooner than 6 hours would be ideal, and we might have a better overall outcome. It also brings into question the cause of acute kidney injury in these patients, as none of the patients in this study had bilateral renal infarcts, despite a high percentage having signs of acute kidney injury. All that said, it is a very well done study. The conclusions are also well thought out, stating that although bilateral aortic thromboembolism is a devastating disease, treatment with or without thrombolysis is associated with about a 37.5% discharge rate, and with some cats experiencing over a 1-year survival. Based on the results of the present clinical investigation, the administration of TPA cannot be advanced as a current standard of care. However, the administration of TPA did not appear to worsen the prognosis or cause higher bleeding risk during concomitant thromboprophylaxis. On occasion, we will see these cats present to neurology, often for paresis, so it is definitely something to keep in mind, but we usually see them well after the 6-hour mark, so I don't know if this applies to at least the group of cats that we see on neurology clinically. I do see dogs as well with aortic embolisms, but most of the time the dogs have more of a chronic disease and are not as severely affected, with most dogs also having an idiopathic cause for the embolism. I generally treat dogs, at least initially, with a factor X inhibitor and an antiplatelet drug. I would be curious if a factor X inhibitor could also be used in cats and what effect on outcome it could have. But overall, this is very clinically useful information for anyone that sees cats in practice, as this is a very common disease that we see, unfortunately. But those are my thoughts, and thank you for listening.